Melanoma is a type of skin cancer that arises from these cells in the skin called melanocytes. And these are the cells that give the skin the characteristic tan or brownish color. When these cells start to grow out of control or become malignant, they can invade into surrounding tissue, they can spread to lymph nodes and spread to other parts of the body. Merkel cell carcinoma is another type of skin cancer. It's more rare, but very aggressive skin cancer that also, like melanoma, has a propensity to metastasize to lymph nodes and to other parts of the body. They usually appear as firm, pimple-like nodules on the skin that can be flesh-colored or reddish or a little purplish in color. Your dermatologist has referred you to see our surgical team because, when possible, the best way to treat melanomas or Merkel cell carcinomas is to completely excise the tumor and also to check whether or not the tumor has spread to any lymph nodes nearby. In this video, we want to help you understand what lies ahead and what to expect in terms of your treatment. We want you to also know that we're here to help you get through this and to find the best possible approach for your disease. A wide local excision is an operation where we excise the tumor and we also include some normal appearing tissue around the tumor. This is really important because it helps prevent the tumor from coming back. It ensures that we get all of the tumor cells out at the first time. And the amount of normal tissue that we take will depend on your particular tumor depth or thickness, and we'll talk about that at your consultation. At your visit, when we look at the pathology report, we'll go over that together in great detail. And from that, we'll make recommendations on how much normal appearing tissue we need to take in addition to the tumor. We'll even draw it out for you so you know exactly what to expect. And then we'll talk about the different reconstructive options, whether that be a skin graft or a local flap or some type of staged procedure to repair it. Typically, the sentinel lymph node biopsy is done on the same day as the wide local excision and the reconstruction.
Sentinel lymph node biopsy is a procedure which helps us to determine if a cancer has spread or not to other places in the body. In the case of a skin cancer involving the head and neck, a sentinel lymph node biopsy procedure allows us to have a picture of certain lymph nodes that may or may not have cancer within them. So you will arrive at the nuclear medicine clinic, and there the sentinel lymph node procedure starts with an injection around the primary site of the skin cancer. This involves 4 small injections of a tracer around the site of the cancer. And this tracer travels along the same pathways that a cancer would travel if it has spread. The tracer collects in a particular lymph node, which is identified as a sentinel lymph node. The sentinel lymph node represents the lymph node which has the highest likelihood of having cancer spread to it. And after a period of about half an hour, we take a picture involving a CT scan to determine which lymph nodes are highlighted by the tracer. This allows the surgeon to identify 1 or 2 lymph nodes to remove, and we can determine with high confidence whether or not that lymph node has cancer or not. From the time of injection to your actual scan, there's a time of about 90 minutes which the tracer needs to travel to the sentinel lymph node. The scan itself takes about 30 seconds to complete, so you can expect to be in the sentinel lymph node procedure for roughly 1 to 2 hours.
After your surgery is scheduled, the pre-anesthesia clinic will contact you to set up an appointment. They will then go over a checklist to make sure you're ready for your surgery. The surgery center will call you the day before your operation to review the check-in time and location. Depending on what surgery you have scheduled, you may also be scheduled for an appointment with nuclear medicine on the morning of surgery. The surgery center transport will take you to radiology for that appointment. The wide local excision and the sentinel lymph node biopsy will be done by a specially trained melanoma surgeon, and typically the reconstruction is also done by the same surgeon. These procedures are typically done under general anesthesia. To make sure that general anesthesia is safe for you, You will be seen by the pre-anesthesia clinic well in advance of the surgery. And on the day of surgery, you'll meet the anesthesiologist who will be handling the anesthesia. You'll meet the surgical team in addition to the surgeon that you meet in clinic.
You will also be meeting with the nuclear medicine technologist who will be performing the injections of the tracer. And you will also be meeting with the nursing staff involved in taking care of you during your operation. Following this, you'll be taken to the operating room. During the operation, you'll be under general anesthesia. You will not feel or remember anything from the surgery itself. The removal of the sentinel lymph node involves roughly a 1-inch incision, either in the cheek or the neck. This occurs at the same time of the surgery to remove the skin cancer. Now, there are specific nerves in the area of the cheek and neck that are important to identify and preserve. These nerves control the motion of your face and sometimes of your shoulder, but we take great care to remove only the lymph nodes. Rarely, the tracer that's injected into the skin cancer does not travel or does not identify the sentinel lymph node. In those cases, we are unable to remove the sentinel lymph node as it's not identified. If this occurs, then we will monitor the areas in the head and neck with routine imaging following your procedure. Once your surgery is complete, you will recover from anesthesia in our recovery unit. The lymph node will be sent for pathologic analysis, which will usually take roughly 1 week for final results. The sentinel lymph node procedure provides us important prognostic information for the care of your cancer. Essentially, it allows us to determine whether or not the cancer has spread with a high degree of confidence. The procedure itself is not a treatment, but rather provides us important information to determine whether additional treatment is necessary. As with any surgical procedure, the sentinel lymph node biopsy procedure involves certain risks. The main risks to this type of procedure are infection. You may experience swelling around the incision, which can be treated typically with topical treatment. If you do notice redness or swelling around the incision, the first thing to do is to let your provider know. We may suggest applying certain topical treatment to the area. If the area does look more concerning than a mild infection, we may prescribe you oral antibiotics. Another risk of surgery is the development of a seroma. A seroma is a small collection of fluid which naturally is absorbed by your body but can collect in the space of your surgical site. If this occurs, this will usually resolve on its own without any further treatment. In the case of a severe seroma, this may need to be drained through a small procedure. If you notice an increasing swelling and enlargement around the site of your surgery, the first step would be to contact your medical provider. There's a small risk of stiffness or limited movement in the area of surgery, and this is usually related to the natural healing process. These symptoms are typically self-limited and will resolve within 1 to 2 weeks. There is a risk of a scar which develops in the site of the incision. That risk is unavoidable, but there are certain things that can be done to minimize the appearance of the scar. It's important to keep the scar out of the sun. The second thing is to apply ointment to allow that area to heal. And the third would be to provide massage to the area to optimize healing. If your surgeon decides to use an additional dye during your surgery, you may experience blue urine following your procedure. This is not a cause for alarm, and again, should resolve several days following your surgery. As you recover from anesthesia, you may awaken with some feelings of fatigue and forgetfulness. These symptoms are typically very acute and will resolve before you leave the hospital. For several days following the surgery, your judgment and reflexes may be slightly impaired. Following your procedure, you will follow up with your doctor roughly 1 week after your surgery. At this time, the results of your final pathology should be available, and you will discuss with your doctor what your next steps in treatment will be. Your incision will be covered with Dermabond. This will stick to the skin for about 7 to 10 days. The glue will naturally flake off by itself. Shower and wound care instructions are the same as for wide local excision. As with wide local excision, mild swelling at the incision site and numbness around the incision is normal and usually stops with time. Limit your physical activity for 1 week after surgery. No lifting, bending, or straining. Do not lift anything heavy over 10 pounds or exercise for 1 week. There are no restrictions on what you may eat. You should return to your normal diet. Take your prescription pain medication for the first few days after surgery as needed. After that, you will be able to wait longer between doses. Adding ibuprofen, 2 Advil, or the equivalent every 8 hours to the prescription medication will also help the pain control and may be started the day after surgery. Call if you begin to have drainage, increasing redness, or significant swelling at either of the incision sites, or if you develop a fever over 101 degrees Fahrenheit. When you meet with your doctor following surgery, we'll discuss the results of your pathology. Based on the results of the sentinel lymph node biopsy, we will determine what your next steps in treatment will be. Depending on the results of your final pathology, we do have several clinical trials available to determine what the ideal treatment for your cancer will be. I believe sentinel lymph node biopsy provides us with a minimally invasive approach to obtaining vital and important information that will guide your cancer treatment. In the past, we relied on more invasive surgeries to obtain the same information that we are able to obtain with sentinel lymph node biopsy.
Even patients with advanced tumors are curable if the tumors are treated appropriately. The key is to find the right combination of treatments to address your particular tumor.
I'd like to assure you that we will do our best to take care of you. We understand that having a cancer diagnosis is very life-changing and life-altering, and we will walk with you through this journey.